Hello, my name is Dr. Heather Gornick. I'm the co-director of the Vascular Center at University Hospital's Harrington Heart and Vascular Institute in Cleveland, Ohio, and I am the proud chair of the 2024 ACC-AHA Guideline for the Management of Lower Extremity Peripheral Artery Disease, or PAD. And with me today, Dr. Herb Aronow, who's the medical director of the Heart and Vascular Service Line at Henry Ford Health in Detroit, Michigan. We as a writing committee took the opportunity to use this document as a call to action and wanted to raise awareness on areas that need more focus in terms of research and also advocacy of our sponsoring and collaborating organizations to make care better worldwide for patients with PAD. So Herb, take us through those research priorities and some of the advocacy priorities we identified.
Yeah, happy to do that. I think like any good study, it answers fewer questions than it raises. And I think that was the result of our process of reviewing the evidence base. We ended up with many questions that we realized remain unanswered and that will need our attention, just like we identified many advocacy priorities where our work will just be starting. There are many evidence gaps, and we focused in on 11 of them. And there are also many advocacy priorities, and there we focused in on 8. Examples of the research gaps, for example, the evidence gaps are a better understanding or need for research around patients who are asymptomatic and the role of screening and how that might influence the implementation of medical therapies, development of new medical therapies and evaluation of them to prevent major adverse cardiovascular and limb events, or MACE and MAL. More trials to look at how we use antithrombotic therapy and what the ideal regimens, the role of remote efforts to have our patients undergo exercise therapy for symptom mitigation, and a number of other research priorities that we felt deserved attention. On the advocacy front, there are a number of notable areas. One is the American Heart Association-led PAD National Action Plan, which helps raise awareness and facilitate detection and treatment of PAD amongst our patients. And so we felt this was a high priority. It goes without saying that dissemination of the guidelines is another advocacy priority, and that we need to incorporate more quality outcomes within some of the work that we're doing. There are issues with access, and you've heard about some of these disparities already a short while ago, and we feel that's an important focus. And then, of course, other means to improve access, such as telehealth and other interventions.